I just wanted to give a bit of background on where I'm coming from both of these directions, and to tell you what hyperemesis gravidarum means, because it's a big long Latin phrase and it just means lots of sickness in pregnancy. And hyperemesis gravidarum is the extreme end of the pregnancy sickness continuum. And I started volunteering with pregnancy sickness support back in 2011 when my daughter was a baby. And I became a trustee in 2014. At that time, pregnancy sickness support was a very small charity, but it has grown immensely over the years. And we now run a helpline, which has over 300 contacts a month. And we have over 450 volunteers nationally providing peer support. And that came from a standing start about 10 years ago. The charity was founded in 2002, but had quite a small profile until then. Can I have the next slide, please? I feel like Chris Whitty. Long COVID support is obviously a much newer venture for obvious reasons. Hyperemesis gravidarum, which I will call HG from now on, because that's just too long a thing to say all the time. HG was noted by the ancient Greeks, so it's always been part of the human experience. But long COVID obviously is a new thing. Post-viral illness in general isn't, but this particular variety of it is. Long COVID support is now a charitable organisation, not for profit, but it started as a grassroots thing. And it started with people with social media. I mean, it wouldn't have happened without social media. People got together saying, look, you know, I'm supposed to get better in 2 weeks, but I'm still ill. Is anyone else still ill after weeks? So anyway, we got together and started providing support for each other. And this has expanded out into other areas like employment rights, advocacy, research, and other strands. We run a support group on Facebook, which has 45,000 members from over 100 countries and territories, which gives you the kind of sense of the scale of this thing. Could I have the next slide, please? So in this talk, I'm going to talk about false narratives quite a lot, and how they relate to disease and how they can then have an effect in real life. And this quotation comes from a paper by the Patient-Led Research Collaborative. And this is a group of people with long COVID who came out of the Body Politic group on Slack, which is an American-based, although it's international, but it is mostly USA-based group of people with long COVID. And they started doing research. So they were the first to publish on long COVID. So this paper here describes how they have come to be. And they talk about the false narratives, starting with the one that said you would get better in 2 weeks, which obviously just wasn't the case. And it was apparent pretty early on that if anyone had looked, they would have seen that people weren't getting better, but it depends what you mean by recovery. If you define recovery as you've gone home from hospital, then fine. But if you define recovery as you've got back to your normal life again, then everybody wasn't getting better in 2 weeks. And more false narratives come along. So they come along thick and fast, that it's only a respiratory disease, that only people that were in hospital would have long COVID, that long COVID is worse, the worse your acute illness was. So all of these false narratives just come along and you're continually combating them. But I want to pick out two in particular to talk about here. Could I have the next slide, please? And I'm going to be showing you a lot of testimony from people with HG and people with long COVID, and look at some parallels between some of the things that go on, and even though these are very different illnesses. So the first false narrative that I want to talk about is it's not that bad. And this is something you find a lot in illness, and especially in women's illnesses, although men are also affected by long COVID. And it's debatable the extent to which there is an association with being female. Prospective studies are finding that it's not as female as some of the retrospective studies have shown, and that may be because of health-seeking behaviour and more women are presenting to be diagnosed with long COVID. But we're fairly sure that long COVID affects more women than men, but men are also affected. So it's not that bad narrative is especially true of conditions where you have a milder version of the same thing, And with pregnancy sickness, it can go from feeling a little bit queasy occasionally to hyperemesis, which is in the extreme, it's fatal. Deaths are rare in Western societies now, but I bet they aren't in places where you can't get access to treatment. And before modern medicine, before antiemetics and fluids, the fatality rate for HG was about 10%. So there's a huge spectrum, and most women will have some degree of pregnancy sickness. So when women with HG are telling their doctors and their friends and so on that they're really sick, they get, oh yeah, I had morning sickness, yeah, just try a ginger biscuit. So people around you have no clue about how bad it really is. This adds to the depression you have. You feel alone and misunderstood. I had days where I hoped to miscarry to stop the illness and go home from the hospital. The hospital staff didn't take the condition seriously. I felt very alone. So, and in long COVID, we're hearing this as well. We're starting to hear this kind of narrative with people losing their jobs because they can't work anymore because of the illness. I'm not working. I wasn't able to go back to work, and then I got made redundant. I can't imagine how I'm going to find a new job, but my life is just nothing like it was, and it's not really the life I want. This person's lying on the floor, short of breath, and the GP is saying, well, you don't really sound too out of breath over the phone. Next slide, please. I did a little bit of work. I've done, as was said in the introduction, quite a lot of my own patient-led research on HG. This was partly in response to reading medical literature and finding that it was absolutely nothing like my experience and like my mother's experience and my sister. So we have it in the family, my mum and sisters. We've had it in every pregnancy we've ever had, and it is horrific. And then you read the medical literature and you just think, I mean, have these people ever met anyone with HG? Because this just doesn't describe my experience. So I started doing my own kind of work within the community. And these are the kind of words which come up: horrific, isolated, suicidal, torture, trauma, lonely. This is not a minor illness. And I did the same thing with long COVID. At the weekend, I asked people in the Facebook group just to say, if you could describe it in single words, how would you describe long COVID? And this is what came up: exhausting, life-changing, frustrating, pain, scary, lonely, debilitating. So the "it's not that bad" narrative is something which is put onto these illnesses by people who really don't understand what it's like and haven't really delved into speaking to people and finding out their experience. Next slide, please. So the next one that I want to talk about is it's psychogenic. What I mean by that is that this is an illness which has its root in psychological conflicts. So rather than being an illness of organic origin from metabolism or infection or some process going wrong in the body, it's actually coming from your psychology. And then it's perhaps psychosomatic, or it's caused by anxiety, which is then causing physical symptoms. So this is a really, really entrenched idea in a lot of societies, particularly Western society. And in HG, it has a very, very unfortunate and long tradition, which goes back to the sort of mid-20th century with the rise of Freudianism. Now, before then, when women used to still die from it, from about before the 1940s, it was treated as a serious illness. But then Freudian ideas started coming in, and then there was an idea that it was perhaps psychological. Antiemetics were introduced in the 1940s and fluid treatment, so fewer women died from it. So then it wasn't such a serious illness anymore, and the psychogenic idea became very, very popular. However, it still persists. And every week we will have a woman on the helpline saying that her midwife, her doctor, her nurse, her partner, her mother-in-law, somebody will have told her it's in her head and she just needs to go out and have a walk and stop thinking about it or something. So we hear this a lot, even from healthcare professionals. It can't be genuine morning sickness or HG because that only occurs in the first trimester of pregnancy. Your condition is psychological. Morning sickness is all in your head. So if you think you're going to be sick, you will be. And this is GPs. These are people who've been to medical school and they firmly believe what they're saying. In long COVID, we're beginning to see this now as well. My GP called back and just said, oh, well, it's probably anxiety. He didn't seem to have any idea what it could be. I felt fobbed off. The only reason I wanted the test is, however lovely friends are, it didn't fit the 2-week image they have of what this illness looks like. They said, are you sure this isn't anxiety? High pollen? I wanted a positive test more for validation. And who is believed about, about their illness, although there are men suffering this as well. There are men in our support group saying the doctor doesn't believe them. But I think women start from a lower base of being believed about pretty much anything. And so it's a sort of bigger problem for them. And we've heard from Louise about women being dismissed about their menopause symptoms. And so this has always happened in HG, and it's beginning to happen in long COVID. Next slide, please. But it has a long history, and people with ME and chronic fatigue syndrome are very, very familiar with this situation. And they're really keen that this doesn't happen with long COVID because they've really been victimized by this. And essentially, it is pseudoscience. It's psychobabble. It really is absolutely a worthless scientific idea. Any studies which have been done in HG, which have been designed to look at cause and effect, because you can take any number of women you like with HG. If you talk to them, you'll find a lot of them are depressed, a lot of them are anxious. But if you try vomiting 40 times a day, let me tell you, you'll be depressed and anxious. If you're going to lose your job because you can't work, if you can't look after your children, you can't get out of bed, you're going to be anxious, right? But this has been then cast as, oh, well, it must be that's causing them to be sick, rather than the other way around. So when studies are done which are equipped to examine cause and effect, which can look at the cause and effect relationship, the evidence shows that there is no cause and effect relationship. Anxiety, depression do not cause the symptoms. And actually, we know now since recent discoveries what does cause HG is caused by a protein that comes from the placenta. That's a whole other story. But there is just no evidence whatsoever that psychological conflicts are causing illness. So in science, when you have a hypothesis and you test it and you find out that your hypothesis was wrong, generally speaking, you move on. You go, okay, that was wrong, let's move on. But we don't seem to do that with a lot of illness and with a lot of women's illnesses in particular. This pseudoscientific idea is really, really entrenched, and it comes from lots of different directions. Next slide, please. So I want to talk now about particular false narratives that pertain to, rather than general ideas, actually specifics of the illness. And this is related to the fact that nobody's ever really done a proper natural history of HG. It's never really been properly described. Pregnancy sickness has, actually, by the founders of PSS, Roger and Tony, who are GPs who founded PSS, and they did the first work to actually describe pregnancy sickness, because again, it hadn't really been described either. Nobody was interested enough. So the ideas about general morning sickness have been sort of transferred over to HG. And one of the really, really strong ones that we constantly fight against is that it stops at 12 weeks. And that's because regular morning sickness, pregnancy sickness, stops at 12 weeks, or it's actually not 12 weeks, it's more like 14, and it's only for 50%. So even that's not even really true, but there's this very fixed idea that it's a first trimester problem. And that's just been sort of cast over onto HG as if it's the same thing, and it's not. Half of women are still taking antiemetics at birth. That was data that I uncovered in some of my work. And we know anecdotally that it just does not stop at 12 weeks. I don't know anybody with HG where it stopped at 12 weeks. And what happens then is that because this is how the illness is cast, and that's how doctors understand it, you're going to your doctor saying, 20 weeks, 25 weeks, 30 weeks, I'm still being sick. And you're being told, no, it can't be as bad as that at this stage. And then the psychological idea comes out, no, you just need to get positive about your pregnancy. That's why you're still being sick. My GP didn't want to prescribe anything or sign me off again at 28 weeks, as sickness is normally better by 20 weeks. You won't need medication by 20 weeks, so I won't give you a repeat prescription, said my consultant. I then ran out of meds and ended up admitted at 21 weeks for fluids and more meds. Same happened at 41 weeks. So these ideas, these wrong ideas about illness, end up in real life causing harm, causing actual material harm to people with the illness. Next slide, please. And then that leads to stigma. This is how it works. So the disease is incorrectly described. It has an overlay of psychogenesis and thinking it can't be that bad. So you must be some kind of drama queen making a big deal about it. That then leads to the healthcare practitioners thinking, well, this person keeps coming to me with these symptoms, claiming to have these symptoms. And I kind of don't see any evidence for those symptoms. So maybe they're making it up. And then that leads to stigma, and that's where you get the disbelief. And you get accusations of doing it deliberately to yourself. The doctor asked why I was not eating or drinking. Did I not know I was making myself worse and was harming the baby? She questioned whether or not I wanted the baby to survive and accused me of doing it on purpose. I'm sad to say that all the nurses, midwives, doctors, and consultants at my local hospital either didn't believe me, thought I was suffering depression, which was causing my sickness, accused me of not wanting the pregnancy, or just ignored me entirely. And in long COVID, we're beginning to see this too. My employers have refused to accept or acknowledge I have long COVID because when I got sick, we didn't have COVID tests, so I wasn't able to produce a test result, despite occupational health even stating I have all the symptoms. I feel like I have to hide my symptoms from some colleagues as they don't understand long COVID or even think it exists. And this is what ends up happening. So you as a person with this illness, you just get fed up talking about it. Your friends are saying, "Oh, you're still unwell," and they get a bit distrustful of you. And you have to start explaining about it. You have to start explaining, look, it's not just pregnancy sickness. Look, it's not just that I'm tired for other reasons. And you just end up so fed up, you just stop talking about it. So you just pretend it's not happening. Next slide, please. And the really serious result of this in terms of HG is terminations of pregnancy. In long COVID, you can't just opt to not have long COVID, you're stuck with it. But we are hearing of people attempting suicide with it. But with HG, you can opt to not be pregnant anymore in a country which has safe and legal abortion. And that's what happens. So from the research that's been done, it's difficult to get figures, but from what we know, between 5 and 15% of women with HG will terminate a pregnancy because of HG, because they can't get treatment. The doctor wouldn't prescribe anything stronger than cyclizine. When I went to the GP to beg for stronger drugs, I was shouted at and told to leave. This woman had a termination. If my doctors had listened to me, I would have kept it. It will haunt me forever that I didn't get help and terminated my pregnancy. I just wanted one person to ask if I was sure, to say, but why we can help, but no one did. I always feel like I'm in a big, deep, black, dark pit when HG hits, so I can't think clearly. The second I came around and didn't feel sick, I was devastated beyond words. Next slide, please. So what does disease look like when it's defined by clinicians or defined by people who have it? So who defines disease at the moment is very much a clinician-led endeavour. And patients haven't really been involved in it that much. So when it comes to HG, according to the definition that was used up till recently was that you needed to have IV fluids, disturbed electrolytes or ketones in urine, and weight loss of more than 5%. Now, in order for you to have that diagnosis, you have to be seen by a healthcare professional. You need to have gone to hospital for fluids, and you need to have somebody done a test on your urine. Weight loss you can manage, you can measure yourself. But the others require somebody to have given you some kind of healthcare, and none of them relate to symptoms. Next slide, please. So recently, in recent years, people with HG or who have had a history of HG, who are involved with PSS, have started to initiate research. And we went through a consensus definition process, which was published last month, just a few weeks ago. And it's called the Windsor definition because we did the final consensus meeting at the the conference that we organised in Windsor in 2017. When I say we organised, I mean PSS organised. And the HG research space has room for people affected by HG because basically no one else is interested. This is not a research field where there are big grants to be won, and there are a lot of papers out there. We've spent years trying to get people interested, trying to get, like Louise with menopause. And so we've just occupied that space, and we've created networks with obstetricians, gynecologists, midwives, other doctors who are, and pharmacists and other people who are interested and want to work with us. So we did this consensus definition. Next slide, please. And this is our definition. This is the consensus definition from a consensus of professionals and patients. Symptoms start before 16 weeks, severe nausea and vomiting, you can't eat or drink, and you can't do your daily activities. Now you'll notice that those things, none of those things require a test. You can self-diagnose all of those. And they also require that for a doctor to give you that diagnosis, they will have to believe what you're telling them. So they'll have to believe you when you say you started being sick early in pregnancy, that you've got severe nausea, that you can't eat or drink, that you can't do your normal things, unless they come and live in your house and observe you. The doctor's going to have to take your word for it when you turn up and ask for a diagnosis. And there are no biochemical tests here because those tests, the need for IV fluids, disturbed electrolytes and so on, they bear absolutely no relation to symptoms. And it's the symptoms that women care about. I don't care what's in my electrolytes. I care that I can't eat and I can't look after my kids and I can't stop being sick. Next slide, please. And with long COVID, do you know what the interesting thing is? Yesterday, the WHO produced a consensus definition for long COVID, but I'd already sent off my slides by that time, so I couldn't add it in. So I've just been, it was just unfortunate timing. But the WHO have also worked with patient groups internationally and with professionals, and they have come up with a consensus definition for long COVID. And patients also, people with long COVID have been occupying this space because there was a real need. We perceived that we were left out of the narrative early on. Nobody was talking about this, and we've been putting in a whole lot of time and effort in occupying this space and being heard and making sure that we are part of that definition from the beginning, so that we don't end up in that position which HG has been in for decades and decades, where they've been working under the wrong definition and then patients suffer. And another point to make about this is the unpaid labour of women. The support groups and in the States and in other countries and in the UK are very largely dominated by women. There are men who are campaigning on this as well. But when you look at our at long COVID support, there are around 40 core members who are active. 32 are women and 8 are men. In the patient-led research collaborative, it's mostly women as well. And again, it's women's unpaid labour supporting each other, doing lots of work which is unrecognised and unpaid, which is actually making a difference here. These two papers that I'm showing here on this slide by Felicity Callard and Elisa Perego do describe that journey and all that work that was done. Next slide, please. And the work of, thanks. The work of the patient-led collaborative, which I show here, this is the first paper, May 11th, 2020 was the first publication on long COVID, and that was by people with long COVID who had studied themselves because nobody else was doing it. Could I have the next slide, please? I picked this up off Twitter. I just thought this was a really good quote, that once a lie is out there, it takes constant vigilance to keep it from reaching hallowed status. And once a false narrative of disease is out there, once it's in a Nature paper or the Lancet or JAMA, honestly, you're now fighting against that kind of, it's now entrenched. It's now going to be, that paper will be cited forever, and you're going to be fighting against that to try and get that false narrative back out. And this quotation on Twitter was describing AIDS activists, and it was from an article which described what AIDS activists were up against this way back in the 1980s as well, because there were all sorts of false narratives around AIDS. Could I have the next slide, please? And I just want to leave you with this, because I like to leave with the words of people who are suffering from these illnesses. COVID is a thief. It has stolen our lives we once knew. That's a quotation from somebody in one of the support groups. And although HG is a pregnancy condition and a pregnancy lasts for 9 months, so you might think, well, it's a temporary thing. Actually, it affects women way beyond their pregnancies. HG affects me every day, and that it affects my willingness to be pregnant again, to give my existing child a sibling. It saddens me greatly that I can't be normal. I feel robbed of having a joyful pregnancy. And all those women who have terminated pregnancy and their partners, they have to live with the grief of having lost a wanted child and then finding out at some later date that actually they could have been helped. Somebody could have given them healthcare and didn't. And they lost a child from that. And that's something that they will live with for the rest of their lives. So I just wanted to leave it there. And thank you for the opportunity for speaking to you today.